I think it's a fantastic initiative, and I just can dream that we could have the same in Belgium, because it was a very nice open forum, an open discussion between peers, equal people, interrupting me, asking me to see and to have the latest info, the best info that they could get out of me. And for me it was nice to have this kind of interaction. And of course you immediately feel that these are high quality people, because they know what they are looking for, they know what has to be done, and no, it's a fantastic initiative. It's in fact a very simple technique. You draw a little bit of blood from the patient, and with this you can make membranes that can be used as a kind of a filling material, as a bone substitute, or a product that can enhance soft and hard tissues, like for example during plastic surgery, sinus augmentation, to preserve the ridge after tooth extraction. So it has many potential characteristics and many potential indications. It's a fantastic construct, and the nice thing is, first of all, it comes from the patient, so it's extremely safe, and it is also extremely cheap. It nearly costs anything, instead of these products that we normally use, like bone substitutes that easily cost 100 euros or more. So it's a fantastic construct, a fantastic product. For sinus augmentation we need quite expensive material, but with this construct you can replace it, and this is then really inexpensive for the patient and also easy to handle. For plastic surgery we often have to take a graft, a connective tissue graft from the palate, but with this construct you don't have to take this painful graft from the palate, but you can just make it from the blood of the patient. So there are many advantages, especially for the patient. There are still a lot of clinicians that do not really trust the technique or the approach because of a lack of high quality scientific papers. For some indications there are already a number of very well and good performed studies. For other indications they are not. And I think it's a responsibility of myself at the university to look into this more in detail and to fill in all the gaps research-wise that are needed before a clinician can really start to use it for all the indications that I have mentioned before. Periodontitis is a huge issue, huge problem. A lot of people are suffering from it. We guess 50% of our population and perhaps even more. And there are clear indications that periodontitis can have an effect on general health. So from this point of view, it is of utmost importance that people that are suffering from periodontitis have their periodontium, their teeth, treated in order to prevent other serious problems like heart attack, early birth of a baby, low birth weight. There are even some indications that it might have an impact on arthrosis and so on and so on. So it is really very important that this gets better seen in the population, better understood in the population, so that these patients are really looking for their teeth in the future. There are many things happening at the moment. One of the things is that we try to improve the outcome of the treatment. We also try to facilitate the treatment to make it more simple for the patient. The most important issue, however, is that the patient has to have a perfect oral hygiene, and that's the basis, the fundament of the success. And here I have the feeling that with these very optimal electric toothbrushes, the interdental cleaning, and some very good mouth rinses, and Spain is known for a very good mouth rinse, can already help a lot. So yes, but I mean, this is an area that changes year after year, only in a positive sense, of course.